Pregnancy Week 15. As your pregnancy progresses, your body is going through various changes, and your baby is developing. You may experience a boost in energy and some relief from challenging symptoms. Due to increased blood flow and lubrication, your sex drive might come back in full force, making sex feel better than ever. At this stage, your baby's features are beginning to take shape. Week 15 Pregnancy Ultrasound. If you have an upcoming ultrasound at 15 weeks of pregnancy, you may be able to determine your baby's gender if you haven't already. Although you can't feel it yet, the ultrasound will show that your baby is moving a lot inside your belly, since they can now move all their limbs and joints. Your baby's lungs are developing, and they might even be hiccuping, but you won't feel it yet. At 15 weeks, you may have some important tests, such as the quad screen and amniocentesis. These optional tests can detect neural tube defects, Down syndrome, or other genetic conditions. You can discuss with your healthcare provider which test is right for you. You may opt for a diagnostic test if the screening results show a higher risk. Week 15 Size of the baby. At 15 weeks pregnant, the baby is as big as an apple, measuring about 4 inches and weighing around 2.5 ounces. Babies' proportions are becoming even more normal since their legs now outmeasure their arms. Week 15 Baby's Development. At 15 weeks, your baby's facial features and ears move into position. Joints are developing, and they're learning how to breathe. Their eyes are sensitive to light, and their hair pattern is forming. This week, a layer of soft hair called lanugo may be growing. Your baby is becoming more active, moving, turning, and rolling around in the amniotic sac. They're developing taste buds and forming nerves connecting them to the brain. Their ears are also growing, and they can now hear you. Thin, translucent skin covers the blood vessels, now moving up to 100 pints of blood daily, supporting the pumping heartbeat of your baby's developing heart. Your baby's skeletal system and muscles continue to grow, and they are likely making lots of movements with their head, mouth, arms, wrists, hands, legs, and feet. Week 15 Pregnancy Belly. By 15 weeks of pregnancy, a noticeable bump may form in your belly, as your uterus expands and accommodates your growing baby. During the first trimester, the uterus can fit within your pelvis, but at this stage, it starts stretching and will soon outgrow its previous location, moving higher up in your abdomen. However, every woman is different, so it's normal if you don't have an obvious baby bump yet. First-time moms might take longer to show than women with previous pregnancies since their uterus has already been stretched before. If you're carrying twins, you're likely to show earlier than with a single pregnancy, as things are expanding faster. You should gain around 1 pound per week if you weren't overweight before pregnancy. It's recommended to eat an additional 300 calories per day and try to make them healthy calories. If you experience sudden or excessive weight gain, notify your doctor immediately, as it could be a sign of a severe pregnancy condition known as preeclampsia. Week 15 Pregnancy Body Changes. At week 15 of pregnancy, you may start feeling relief from early pregnancy symptoms and notice increased energy. This could be due to increased blood flow, which can also cause side effects such as changes in blood pressure, bleeding gums, nosebleeds, and headaches. Nausea should have cleared up by now, but if you're still feeling sick or vomiting, it's best to consult your doctor. Weight gain is normal as the baby and pregnancy develop, and changes in the areola, hair, and nails are also common. These body changes are normal at this stage of pregnancy as the body adapts to the growing baby. Week 15 Pregnancy Symptoms. Stuffy nose and nosebleeds. Increased blood volume and hormonal changes can lead to nasal congestion and occasional nosebleeds. Swollen and bleeding gums. Hormonal changes can lead to inflammation and increased sensitivity in your gums, causing them to bleed more easily. Round ligament pains. As your belly grows, you may experience sharp or dull pains in your lower abdomen or groin area as the round ligaments stretch and accommodate your growing uterus. Increased sex drive. Some women experience heightened libido due to hormonal fluctuations. Heartburn and indigestion or gas. The growing uterus can put pressure on the stomach, leading to heartburn, indigestion, or gas. Thicker and shinier hair. Some women notice changes in hair texture and appearance due to hormonal shifts. Cloasma or the mask of pregnancy. Some women may develop dark patches on the face due to hormonal changes. Swollen hands and feet. The body's retention of fluid can lead to swelling in the extremities. Urinary and vaginal infections. Hormonal changes may increase the risk of urinary tract and vaginal infections due to pH balance alterations and increased vaginal discharge. Leaky breasts. Your breasts might start leaking a yellowish fluid called colostrum as they prepare for breastfeeding. Varicose veins. Enlarged and swollen veins, often in the legs, can develop due to increased blood volume and pressure on the blood vessels. Week 15 Pregnancy Checklist. Consider tasks such as financial planning, enrolling in childbirth classes, and exploring childcare options. Discuss with your healthcare provider about the various birthing locations available to you. Check what options are accessible in your area and what your health insurance covers, if applicable. If you work, research your maternity leave options, including how much time is available to you and how much of it might be paid. It's helpful to plan, even though you still have several months. Start researching newborn essentials and creating your baby shower registry. Consider keeping a pregnancy journal to record your thoughts, feelings, and experiences during this special time. If you are considering a multiple marker screening, schedule an appointment for it. Similarly, if you are planning to have an amniocentesis, make arrangements for it. Week 15 Pregnancy Tips. Sleep on your side, especially the left side, to help blood flow and reduce pressure on your back and organs. Watch out for signs of prenatal depression like persistent feelings of sadness, anxiety, or hopelessness, and seek help from a healthcare professional if you experience these symptoms. Use a pregnancy pillow to support your body as it changes and improve comfort during pregnancy. Choose loose, breathable, stretchable workout clothing and comfortable underwear to fit your changing body and stay relaxed during physical activity. Keep taking your prenatal vitamins as directed by your healthcare provider to ensure you and your baby get essential nutrients during this time. Schedule a dental checkup and maintain good dental hygiene throughout your pregnancy to prioritize your oral health. Choose healthy pregnancy snacks and superfoods over junk food to nourish your body and baby with essential nutrients and energy. Incorporate gentle physical activity into your routine, such as prenatal yoga or walking, to promote relaxation, flexibility, and overall well-being during pregnancy. It is recommended to avoid getting tattoos during pregnancy. For more videos like this, please like, share, and subscribe.